that's kind of the concept of purchasing. The benefit, of course, is you're operational right away. So even though it's going to take a while to process, the transfer date is actually based on the stock purchase agreement. So you're able to operate the very next day. Hey, this is Larry from the Home Health Consultant. So one of the questions that I get more often than I'd like is, hey, should I purchase a company or should I buy a company? So there's actually three options here. So the first and obvious one is, hey, I want to start a new home health agency. And the concept there is when you start, you have to go through an application process. You have to go through a licensing process with your state. And of course, you have to go through Medicare certification. So depending on the state, right now here in California, and this varies drastically. So month by month, the timeframes can change by several months. So as of today, which is the summer of 2025, we're looking at, I want to say, about a year and a half for just the application process. Getting your first license is going to be very quick, so you can get that definitely within the first month. And then, of course, the accreditation will take several months from there. The cost will vary, of course, very drastically depending on state, and the cost that it'll take for your staff and office and everything else will drastically change. But that's one traditional option. You're looking at an average of, I want to say, right now we're looking at, like, let's say 2.5 years realistically. To say conservatively, we're looking at 3 years. Now, that's option one. Option two, and this is where people get really mixed up, is they're like, hey, I want to buy the first license and then take it to accreditation, which is great. You can buy it for a fairly cheap price, and they think like, hey, that's kind of like a little shortcut to make sure that we go faster. The problem, that's actually the worst way to do it. So the problem with doing it that way is, let's say, and I'm going to throw out a number here. Let's just say you buy the first license for $40,000-$50,000. And again, just throwing out a number. The problem there is, if you want to be Medicare accredited, you can't even start that process until the change of ownership is completed. To finish the change of ownership right now takes about 2 years. You're not saving any time. You're not saving any money. So for me, whenever anyone says that, that's probably the worst option. And option three is, I want to buy something ready to go. So you have to definitely be careful with that, because there is a 36-month rule. So anything prior to 36 months, you cannot actually do a change of ownership. You can do a stock transfer, but majority share has to stay. That's not, and that's really more of a change of information. So you can't really purchase anything within 36 months. So your real option is to purchase anything that's past 3 years. There's pros and cons to that. One of the key benefits of doing that is it's very common to have seller finance. So you can technically not even spend your own money. You can, give them a down payment and then have various terms negotiated with the seller to pay them back throughout like several months or a year or whatever it is. And this way it's the least amount of money from your pocket and you're ready to go and processing it right away. So that's one benefit. Of course, the liability is you are responsible for everything from the seller. So this is not an asset sale. This is a stock transfer. You're buying assets and liabilities. And with a stock transfer, you have to be really detailed in your due diligence. So you have to, because if you get ADR'd in the future, and it's Medicare, and they review it and say, hey, we're not paying for this, guess who's out of money, right? So at the end of the day, You have to be truly careful with what you're purchasing. You have to make sure there's no liens, there's no taxes. You have to make sure you really go detailed into the chart audits. Invest money for QA, for a QA team, and really double check, have they had ADRs? Are they currently in ADRs? What's the status of the company? Because you are going to be taking over everything. So you have to be extra careful with that. So that's kind of the concept of purchasing. The benefit, of course, is you're operational right away. So even though it's going to take a while to process, the transfer date is actually based on the stock purchase agreement. So you're able to operate the very next day. So that's the benefit. Just have to be extra careful with your due diligence on that side of things. So let's talk about cost. The thing about cost is it greatly varies. So what I'm about to tell you, take with a grain of salt and just take as a rule of thumb roughly. So in, let's say, California, the cost of an existing home health agency that doesn't have any contracts, that essentially you're just buying the license at the end of the day. Let's be honest, like, because even though they're operational, it's a relationship. So there's no guarantee of anything continuing. So the cost of those agencies is roughly today $140,000, $150,000, roughly. Of course, a few years back, we're looking at a much different number, but it greatly differs, right? And there's a lot of factors, supply and demand and everything else. Agencies that are operational have contracts with hospitals, have contracts with various insurance companies those are different, right? So at that point, you're not just buying a license, you're buying a multiple. And in this case, I want to say home health agencies roughly run around a 3x multiple, 3 to 4x multiple. Of course, that also depends on the interest rates and other factors. So, but as of today, that's roughly where things are. So of course, cost matters, but it's really tough to give you a cost without understanding the actual details of what's going on. There are companies who sell for 180. There's companies that sell for 500, for a million, for 2 million. There's a lot of different factors involved. So it's not like, hey, here's the market cost and here's what happens. So I'm happy to talk to you about that. I'm happy to go over things with you. I'm happy to, just chat with you and see where things are, how to check the market. Like in California, you can even see what things are going for. There's listing sites like BizBen. You can call a business broker, get ideas from there, but really do your research and due diligence as far as like understanding what a good value, what a good deal really is. So if you're looking to purchase one, there's a lot of factors to consider, and we're here to assist you. We're here to help you. And if you need help with applications or anything at all, we definitely can assist. So to open a new agency from scratch, there's a number of things that you have to consider. And of course, there's a lot of variables as well, but we're looking at the different fees. So let's start with your consulting fees. A consultant will typically range from $30,000 to $45,000. Of course, that's a rough range, and it depends on location and other factors. You're looking at your staff costs. You have your director of nursing. You have your designees. You have your nurses to visit the 10 patients. There's a lot of different factors there as well. It depends on, of course, even the consultant, it depends on how involved they are. They just kind of, you're doing everything and they're just kind of reviewing it, or they really hand-holding the whole process. So that can range as well. There is application fee to the state. Of course, that depends on the state, and it ranges year by year. In California, they usually change it on an annual basis. Right now, I believe it's roughly in the range of $5,000. It was $7,000. And I'm sorry, not California, in Los Angeles County. If you actually get out of Los Angeles County, I believe it's like $2,700, something along those lines. That's just the application fee. Then you have the Medicare application fee, which is not too much. It's $700 or so. Then you have, of course, you have your rent. So you have to have a two-room office, minimum two rooms. Currently, there is no size requirements, but one it has to be double lockable. One room has to act as, a private area where you can have, uh, you could talk to your staff privately and things like that. Um, so rent will be a huge factor. If you multiply that by what, 2.5, 3 years, that definitely adds up. Um, there's going to be a few miscellaneous costs. You're going to have internet, utilities, things like that. Software, for the most part, depending on the consultant, you actually might not need to buy software until after you're operational. In most cases, you will have to purchase a software. There are deals with many software companies where they give you a huge break until you're actually operational and you get your provider number. So they understand that, and they want to have your business. So the way to do that is to give you like, $10 a month or whatever it is until you're actually operational, and that way they buy your loyalty. And of course, there is survey fees. So we're looking at, there's three accreditors. There's Joint Commission, there's ACHC, and there's CHAP. They roughly will all range in the scope of roughly around, let's say, $12,000, broken down by licensure survey and by accreditation survey. Both CHAP and ACHC charge you for the survey, and Joint Commission actually charges you on an annual basis and during the survey, but they all will add up to roughly around the same thing. Thank you so much. Again, this is Larry from the Home Health Consultant. We're here to help and answer any questions you might have.